There are many effective medications for lowering high blood pressure. According to some experts, most people can lower their own blood pressure out of the red zone, without conventional drugs. Scores of scientific research have shown that just eating the right foods can eliminate high blood pressure or hypertension in the majority of people. Even though there's documented evidence of this fact, some doctors will instantly start patients on drugs without first recommending a change in their diet. The many dangerous side effects of high blood pressure drugs more often than not do the patient more harm than good, in some experts' opinion. Drugs only treat the symptoms of high blood pressure, but curing the issue requires nutritional supplements, dietary and lifestyle changes. If you or a loved one has been diagnosed with high blood pressure, usually with a reading higher than 140/90, here are 8 alternative, natural remedies that can bring your pressure down to an acceptable level. Number 1. Water. The number 1 recommendation for lowering high blood pressure is to drink 15 glasses of water a day. The majority of blood pressure medications work by mimicking the effects of increased water intake. Water can relax your entire system, including your arteries, and tight constricted arteries are the main cause of high blood pressure. This remedy is so easy and simple it's almost too good to be true. It's recommended that you drink 1 8-ounce glass of water for every hour that you're awake. Number 2. Potassium-rich foods. Lowering sodium is important because this mineral can raise blood pressure in those who are sensitive to it. Instead of going on a low-sodium diet, concentrate on the increase of the mineral potassium. Potassium and sodium act kind of like a seesaw. The higher your intake of potassium, the lower your level of sodium. There are scientific studies where people were able to get off blood pressure medications just by eating more fruits and vegetables, which are one of the best sources of potassium. It's recommended to eat at least 2 bananas a day. They are loaded with potassium, along with 5 servings of other high potassium fruits and vegetables. Fruits and vegetables have other benefits in which they supply plenty of fiber, which can also help in lowering blood pressure. A high potassium diet can prevent high blood pressure and lower existing high blood pressure. Besides bananas, other fruits high in potassium include apricots, cantaloupe, dates, honeydew melons, kiwi fruit, mangoes, raisins, papayas, watermelon, avocados, nectarines, grapefruit juice, oranges, pomegranates, and prune juice. Some of the best vegetable sources of potassium are Swiss chard, celery, spinach, parsley, watercress, endive, kohlrabi, broccoli, tomato juice, cucumbers, cauliflower, asparagus, artichokes, potatoes, sweet potatoes, and squash. If you have kidney disease, high levels of potassium can be harmful. You should talk to your doctor before increasing your potassium intake. Number 3. Fish. Lowering your intake of artery-destroying saturated fat, the kind found in red meats and dairy products, should be a part of your plan to lower high blood pressure. Omega-3 fatty acids, the type of fat found in cold water fish, can actually help lower blood pressure. Eat fish daily, even twice a day if you can. Some of the fish highest in omega-3s include mackerel, sardines, bluefish, salmon, mullet, herring, and lake trout. If you don't too much care for fish, you can still get your daily omega-3s by taking fish oil supplements. Experts recommend taking 7 capsules daily of a high-potency fish oil, with a minimum of 1,000 mg per capsule. You can also take 3 tablespoons daily of EPA emulsified fish oil. Number 4. Magnesium gluconate. Magnesium relaxes arteries, thus helping to lower blood pressure. It's recommended taking 500 to 1,000 mg of magnesium gluconate a day, divided into 3 doses. Amounts of magnesium gluconate this high may pose problems with people with existing heart conditions. Check with your doctor before taking. Number 5. Coenzyme Q10. The use of coenzyme Q10 is an important component in lowering blood pressure. Research has shown that many people with high blood pressure are deficient of this important nutrient. Coenzyme Q10 helps generate energy in every cell in your body, and it may help improve the condition of the arteries, reducing blood pressure. It's recommended to take 60 to 90 mg of coenzyme Q10 3 times a day after a meal, for a daily total of 180 to 270 milligrams. Number 6. Exercise. Eating the right foods is essential for lowering and preventing high blood pressure, and so is regular exercise. 30 minutes of aerobic exercise, 4 times a week, is recommended to lower high blood pressure. Regular exercise relaxes artery walls and decreases stress. It will also help a person lose weight, and being overweight is a major risk factor for high blood pressure. Walking is the best exercise for people with high blood pressure. It's also the easiest exercise. You can slowly build up the time you exercise, starting with as little as 5 minutes and increasing as you get stronger. For someone with high blood pressure, it's the least traumatic exercise. High-intensity exercise like running or racquetball can be too stressful for those with hypertension. Number 7. Hawthorn. Take 250 milligrams of a standardized extract of the herb hawthorn daily until your blood pressure reaches normal levels, at which point you can reduce or eliminate it. This herb can help lower blood pressure by relaxing the arteries and strengthening the heart. Number 8. Garlic. Scientific studies have shown that garlic, either fresh or in supplement form, can help lower blood pressure. Eat as much garlic as possible, 2 or 3 cloves a day, minimum. You can counteract garlic breath by chewing on fresh parsley. Even people who like garlic have trouble eating this much, however. That's why doctors often recommend using garlic supplements. Follow the directions on the label. Thanks for watching, and don't forget to like the video, comment, share and subscribe.